Hey, what's going on? It's Ian Hart here, and I'm here with Dr. Stuart Smalheiser. So he's a cardiologist here in Beaufort as well as USMC, or?
Yeah, American University, South Carolina.
Okay. And then also he trains here at EarthFit. So what I'm going to do is just ask him a few questions about the heart and how it relates to training and the benefit through also training here at EarthFit and just in general, so we can give you guys a little bit more knowledge. So welcome, and thanks for doing this. I appreciate it.
You're welcome. My pleasure.
All right. So basically, say someone is coming up off the couch, right, and they've been eating a lot and they haven't really been doing any exercise, and they come in and we just start them on a regular cardiovascular program without even going into the training. What effects are they going to see on the heart?
So people are going to have benefit just from going and doing. The biggest benefit to the heart and to the overall body is the initial beginning of an exercise program. If you go from nothing to doing something, you have tremendous benefit. You potentially can live longer. You potentially reduce your risk of heart attacks, strokes, peripheral vascular disease. And that's, at least from a cardiovascular or vascular standpoint, tremendous benefit. On top of that, there's a proven benefit of psychological improvement in mood, reduction in depression. And then at EarthFit, we also have benefit of resistance training. So we also have a reduction or potential reduction in rates of osteoporosis and increase in bone mineral density. So we have at EarthFit an overall exercise program that potentially not only improves patients' morbidity but also their mortality by actually going and doing something.
Great. And I know this is kind of complicated to explain, but for those of the people who do train at EarthFit and they wonder why we do things like stairs in between, and it's kind of like an active recovery, or high knees in between, but really it does have a component to it. And I don't know if you can explain anything about physiology that we put in our program. If it's too complicated, you can just let me know, but if you can say like one word on that from your perspective, from the medical side, could explain something.
So really in an exercise program, what the American Heart Association recommends, and most organizations around the world recommend, is that you want at least 30 minutes of aerobic activity. And when we say aerobic activity, we want your heart rate increased for that 30-minute period of time. And so if you go from set to set to set and your heart rate goes back to normal, you're not getting as much benefit as if you have continuous exercise or continuous increase in heart rate. And so one of the reasons why we do the steppers and the high knees and everything else in between is to essentially continuously exercise.
And burn more calories. And then also has another component to it, which is also flushing out some of the toxins that you get that you are done during the lifting of the weights. And then is there anything else that you could say to somebody out there who maybe has a fear of starting an exercise program, who has a heart condition or heart disease or something like that? What would you say to that person?
So one of the hardest things to do in life is actually to do stuff. And the initial step is oftentimes the hardest. And so patients who've had documented heart disease, strong family history of heart disease, other medical problems that may lead to heart disease, high blood pressure, cholesterol, diabetes, actively smoke, those people probably need to be evaluated before they start. So just like your car, if you go from 0 to 100 miles per hour, you're going to cause some problems down the road. Maybe not all the time, but at least some of the time. And so people who have documented medical problems probably need to seek some advice before starting. And most of the time, as a cardiologist, what I do is I put you on a treadmill and see how far you can walk and go and do and see if there's any electrical changes in your heart before starting a high-intensity exercise program. Usually, if you can walk at least 9 minutes on a treadmill without EKG changes, most people can do quite well in an exercise program. As well, some people that are scared that they're actually going to have a heart attack during exercise, the data has shown that 90% of the time people have heart attacks when they're actually sedentary. And so going and doing and commencing an exercise program is probably the most beneficial thing that they can do.
All right, and that actually reminds me, in the future we probably will have a metabolic training program that's actually designed for people with heart disease. So it's a lower intensity, and it's actually can be referred out by doctors. So we're going to have somebody do those assessments. And we do an assessment here, and we screen people, and a lot of times if their heart rate or blood pressure is too high, we'll send them to a cardiologist like that so they can get evaluated. And then also, just I want to know from your perspective, what has changed since you started EarthFit, in your opinion, about where you were before and how you were living your life and what now?
So on a personal level, I can't tell you that I've reduced my chance of having a heart attack because I don't know what my chances are. But what I can say is that EarthFit has made a major impact in my life. I work many long hours. I have a lot of stress in my life, and EarthFit is the one place during the week where I can relieve my stress. And even from a psychological standpoint, I'm happier than I was. I feel like I can go and I can do more. I have more energy. And as far as benefits outside of that, I'm a lot more mindful of what I'm eating, even though I tell my patients all the time to watch what they're eating. When I get to have to be weighed in every single week, not only including in front of myself, but in front of people who are watching that and recording it, there's definitely I definitely have to do a double take before I eat anything bad during the week, especially as it gets closer to weigh-in time on Monday or Tuesday.
And also, I wish we had a video before of you because you look totally different. Like your face starts to change. Now, were you skeptical about anything about EarthFit, or were you skeptical about the program at all?
Well, I was a competitive athlete in my former life before I worked 60 plus hours a week. So I knew that if I worked at it, I could get back in shape. But as my schedule got busier, and as most people's schedules get busier, it's harder to do that on your own. And so when I moved here, I did a lot of exercise in my house. I have an elliptical trainer, and I went on there for 20, 30 minutes a day, and I managed to get my 5 days a week of exercise, but it just did not get me over the hump that I needed to really get the full benefits of high-intensity exercise. And Ian has done a great job of designing a program where in 45 minutes you get the best bang for your buck. And for me, that's incredibly important because my schedule is incredibly tight, and I don't have the time to spend hours that I can get in the 45 minutes that I get during an exercise program here at EarthFit.
Great. And so, would you recommend it to anyone, and who would you recommend it to?
So, I would recommend exercise to anyone. High-intensity exercise has to be, and as we talked about before, has to be done by the right people. And so if you already exercise right now, going to EarthFit is an easy transition. It may be difficult at first as far as the psychological ramp up, but as far as people who exercise on a regular basis, it's an easy transition. People, as I said before, who have known heart disease, meaning they've had stents, they've had bypass surgery, diabetics, patients with strong family history of heart disease, or other major vascular problems probably need to be evaluated first. But in general, those people probably can go to EarthFit. It's just a question of making sure that they're okay. And for the most part, seeking the advice of their physician is a good start, but everyone will benefit from exercise.
All right, great. And is there anything else that you would like to say to the people out there who have a heart condition or anything about EarthFit or anything in general?
So as far as heart disease, one of the things that I preach in my practice is it's an overall treatment of the patient. And so as much as medications are beneficial, diet and exercise along with medications, are the cornerstone to treatment. And if you don't participate in regular exercise such as EarthFit, if you don't watch a diet, taking medications on their own is not going to be enough of a benefit long term. There's a ton of research that patients who participate in cardiovascular rehab actually live longer. And for me, I see a lot of patients who've had heart attacks. And one of the things that I stress is that to change their life is not just taking medications. Changing their life includes diet and exercise.
So there you have it. It's about overall changing the lifestyle and the habits that you've created, and not just taking medication, which is something that we see a lot of times. People come in the assessment and they say, I take this pill, and they're not doing something. So we take them and try to get that habit created. Thank you, Dr. Stuart Smalheiser. I really appreciate you doing this, and we appreciate you having you here training at EarthFit, and thanks a lot.
My pleasure.